The Community Analysis of Little Ferry, New Jersey by Andrew Daniel. The borough of Little Ferry, New Jersey has a rich and interesting history, and its origins relate to its location along the Hackensack River. On November 20th, 1776, a rope-drawn ferry adjacent to the Hackensack River helped Washington's troops escape advancing British soldiers, marking a significant moment during the Revolutionary War. It is this similar ferry that the community received its name when it became an official borough in 1894. The rich river clay eventually led to a thriving brick industry, and in 1882, Mayorhoff Brickyard became the second largest producer of bricks in the United States, manufacturing more than 2.2 million bricks annually. The World War I and World War II ushered in new commerce, industry, and families to the area. The brickyard burned down in 1956, and this marked the end of Little Ferry's brick manufacturing industry. Today, the community features a diverse population who divides time between the major metropolitan New York City and more suburban communities within Bergen County. Currently, Little Ferry, New Jersey makes up 1.48 square miles, and with a population of 10,626, that makes for a dense population of 7,199.2 per square mile. Structurally, the community of Little Ferry meets the needs of the community members compared to Bergen County and the surrounding communities. Little Ferry ranks higher than the surrounding areas in terms of income and lower in terms of poverty. Cost of living is average to below average for the area, and housing costs are average to below average. The community has several religious organizations that provide food pantry services for the homeless in the community. However, the area lacks in free or subsidized access to health care resources such as after-hour medical care and clinics. As far as issues within the community, there are several vacant storefronts, which does not bode well for local jobs and local economy. Those in the surrounding communities do express a need for transparency within the local government. However, the community of Little Ferry's allocations do not exceed the revenue, and the borough has a balanced budget despite request financial assistance for repairs post-Hurricane Sandy. The community and its surrounding areas also express a need for better roads and more accessible public transit. Little Ferry has a diverse and balanced population with no significant issues. The percentage of those living below the poverty level and or receiving public assistance is lower than that at the state level, but slightly higher than the county level. Birth rates and death rates also minor those on the state and county level. Correlating with the literature, the major health issues are cancer and heart disease, which are both health concerns on a national level. Interestingly, diabetes is not a major cause of death in the community, given the significant portion of Asian residents and the growing rate of diabetes among this specific demographic. This could be related to the availability of recreational spaces for walking and jogging, combined with the availability of healthy food options at reasonable prices, such as those found at the specialty H Mart market, which predominantly caters to the Asian community. Given the number of people living within Little Ferry, the health resources are severely lacking. The community has limited options with regards to physicians, dentists, specialists, pharmacies, and other care providers. This contributes to the lack of affordability, accessibility, and access to these resources. For example, the only general physician within Little Ferry does not accept Medicaid or Medicare. Consequently, three health objectives for this community are access to health services, reduce the overall cancer death rate, and better preparedness, specifically improving the time it takes to issue a health emergency notification. Better health care access addresses the community's lack of health care resources. The leading cause of death within the community is due to malignant neoplasms, inadvertently related to cancer Interventions related to cancer could impact the overall life expectancy and quality of the life for residents within the community. Lastly, in an audit conducted on Little Ferry's emergency management after Hurricane Sandy, the community lacked regarding dissemination of emergency information. In the wake of a public health crisis, this poor communication could prove disastrous. As such, a preparedness intervention is definitely beneficial. Little Ferry's environmental resources are adequate, and no environmental issues have been found to negatively affect the health and well-being of its residents. The community works with Bergen County to provide waste cleanup and ensure a safe and sanitary environment. Little Ferry provides multiple parks and recreational facilities to better serve community residents. Little Ferry's parks cater to all ages and feature walking trails, playgrounds, baseball, and football fields. Additionally, the borough actively promotes switching to solar energy and recycling. Little Ferry ensures residents are kept safe through 2 fire stations, a police force, and emergency first aid. Areas of concern include traffic, accessible pedestrian walkways, especially during the winter months, and lack of bike lanes, which would foster clean, alternative modes of transportation. Currently, pedestrians and bicyclists must endure aggressive drivers and even walk on the road in order to avoid ice or snow. The borough of Little Ferry is governed by a mayor and 6 borough council members. Residents can email or call these officials, and the contact details are easily accessible via the Little Ferry Municipal website. Meetings are not available online, but the city council meeting dates are publicly available and meeting minutes are available by request. Little Ferry has a balanced budget of approximately $16 million. The major areas of concern involve natural disasters and the borough's ability to recover, such as after Hurricane Sandy or the most recent blizzard. One economic area of concern includes the number of empty storefronts, as this does not contribute to a flourishing local economy and can facilitate loitering. No homeless shelters exist within the community of Little Ferry. However, shelters do exist within nearby boroughs. St. Margaret's of Cortana only provides access to a food pantry once a month, and this church is the only one offering such a service. Little Ferry has a history of flooding and did not have adequate infrastructure to alert residents of natural disasters such as Hurricane Sandy. The current emergency notification system does not reach all residents, and the borough has had ample time to address this. Lack of disaster planning and preparedness will have a serious ramification if and when the public health crisis occurs. Little Ferry lacks adequate crossing zones for pedestrians and bike lanes. Although traffic is not too heavy in the area, traffic accidents are quite common. In 2016 alone, 18 pedestrians have been hit and killed by vehicles in northern New Jersey, and recently a man was killed trying to cross the road just outside of Little Ferry in Teterboro. Little Ferry's lack of adequate health care resources and residents may have to travel to nearby communities to receive the care that they need. This presents an issue because residents may not receive affordable, proper treatment if they receive any treatment at all. This is a basic need that is not being met within the community. The leading cause of death for those living in Little Ferry is malignant neoplasms or cancer. However, the nearest cancer resources are outside of the community. This has a lesser level of urgency as resources do exist, although residents may have to travel to nearby Hackensack in order to access them. The second leading cause of death for residents of Little Ferry is heart disease. Preventative measures such as acceptable exercise programs and healthy nutritional options are definitely within a nurse's scope of intervention. Little Ferry has at least 3 predominantly vacant storefronts within the main retail area of Main Street. This does not signify a bolstering local economy, and it proves limited for those who lack access to a car, Additionally, vacant buildings have been shown to affect the safety and health of residents. This can directly affect the behavior of the residents and health of the community. The rankings of these concerns were based on Maslow's hierarchy of needs. Access to health care is a universal yet extremely intricate issue, with access involving individuals who have the ability to pursue and receive care freely with little to no constraint. However, comparatively, Little Ferry's access issues is very different when looking at a health care access on a global scale. For instance, those who live in Africa, in an African country, will have to have the burden of traveling extreme distances to receive health care. Additionally, access to health care on a global scale greatly depends on the government structure, poverty, and income inequality. Bergen County's Bergen County makes an effort to serve county residents by offering a range of free or low-cost health services. While these facilities might not be located directly within the borough, within the county, they are within 5 to 10 miles. Top facilities in New York City are also within 5 to 10 miles.